Welcome to the Q. My name is Nurse Bug. I'm your friendly neighborhood nurse surveyor.
And hi, I'm Tina Webster. I'm so glad you joined us.
Hey y'all, it's Amanda. Thanks for listening.
Today, we're going to be talking about the building blocks for good staff: administrators, DONs, nurses, and CNAs. So we're going to go through each one and then maybe talk about a few positions that aren't on our list, but we want to give some tips and tricks and some knowledge on what each role does. So first, we're going to talk about CNAs. They provide the majority of the hands-on care, ADLs, all that stuff. They're critical to maintaining the function and well-being and quality life of your residents. They're required a minimum of 75 hours of training to be certified, and then at least 12 hours of CEs annually. And that includes 16 hours of supervised practical training covering basic nursing care, skin care, infection control, basic restorative, mental health, behavioral, social services, communication, cognitive impairment, resident rights, safety, disaster training. I mean, the list could probably go on from there. It's a lot. And a study found that inadequate knowledge related to aging, cognition, mental health, etc., was a big thing for CNAs. And as a result, various bodies suggested that required training be increased to 100 to 120 hours, with 50 to 60 towards clinical training. And they need ongoing professional development to adapt to changing needs of our resident populations. Demographics are always changing. And then teamwork across all disciplines and roles. We want to instill those values to foster respect, trust, collaboration, and interprofessional healthcare team building, because they really are, what did you call them earlier, Amanda?
The backbones of your facility.
They really, really are.
They lay the foundation for everything you do in the clinical department and beyond that.
They do. They're your direct link to your residents. They're the ones that touch and talk and every single day. So
absolutely. If it's for continuing education for your CNAs, I think it's critical for sure. If you invest in them, they're more likely to stay with you, decrease their burnout.
Some tips to succeed as a CNA. And this article gave a good list of how a CNA can be best organized for their day. You want to prepare a plan. Being organized and prepping for the day makes it so much easier. Know what equipment and supplies that you'll need so that you won't be delayed. Write down your tasks. Make a list of steps or store them in your favorite note-taking app, however you guys do it, specific to each resident. It's going to sound funny, but carry a fanny pack to keep the most essential supplies, including a pad and pen handy. Until you can manage time, you can't manage anything else. So a good CNA is going to have a plan. They're going to.
Yeah. I was going to say too, right here, for all the facilities out there that you're like, stop hoarding supplies. Just give them enough supplies not to hoard them, right? You want to make sure they have the adequate things that we need. Like, I know washcloths go disappearing in the middle of the day, and you're like, I have no washcloths. Maybe you can invest in those disposable wipes. Of course, that brings in other considerations with your sewage pipe, especially if you're an old building, but re-educate on that. Make sure they don't throw them away. You want their jobs to be as easy as they can be.
Yeah. The second thing was compassion. Usually assisting residents with highly personal tasks is going to take a person who is very compassionate and kind, because residents are going to be embarrassed. You want to establish that climate of mutual respect because it sets the groundwork for a positive experience for them. It makes the residents more at ease when they're most vulnerable. Be a patient listener. We honor each other when we fully listen, and we demonstrate that the person that you're listening to has been heard. You want to pay close attention to what the resident says about their needs and concerns, because you may be the conduit from them to the family and provider. Maybe they can't speak to them the way they can speak to you. You have a duty to them. And there was a quote that said, people do not listen with the intent to understand. They listen with the intent to reply. And you really, really want to listen to understand, especially to residents with cognitive impairments who can't, communicate in the normal ways. It said attention to detail is important. You want to keep a thorough and accurate record of the care that you've given and the health data, because that creates the uniformity of care. They need to understand basic medical terminology, because more understanding of the language of medicine, you understand specific needs related to their diagnosis and all those other terms that are going to go with it. You want to have strong communication skills. You want to be precise and informative and pass along all info, ability to follow protocols and work independently. Know the standards of care. It protects both you and the residents. Continuing ed, make it a point to learn and stay up on the latest safety tips for ongoing education offered through your employer or your community college, because there is reimbursement options usually from employers, because you want to keep fresh and engaged in your career and prepare for advancement if you plan to go that way. Take good care of yourself, healthy diet, good sleep, because the right nutrition and rest helps protect you from getting sick or just as dangerous burnout. Regular exercise and stretching helps too. I went to the chiropractor the other day and the chiropractor looked at me with such disgust. They're like, have you been stretching your quads? I'm like, no, I haven't. Thank you for noticing.
Oh, no.
Oh, man. And then the last tip was do something positive for yourself. Make time to enjoy activities, giving your mind and body a rest from the day, or a little bit of both. Time for yourself gives energy and mental resources to do it another day, because your career is in demand and you want to be great at it. Being great includes the physical element as well.
You mentioned something about documentation, like accurately capturing what they do, attention, uniformity of care, to create uniformity of care. A lot of times it's a second nature to document, and it feels like it's another task that's added to their day. If you take it like this, it's not another task to add to your day, but it provides you, if you document accurately, you're going to get the more help that you need, because you're capturing that uniformity of care of that resident, right? If you're documenting that they need 2 people and they do need 2 people, then you're able in the end to be allotted that extra hand to help.
Yeah. One of the things that I've heard mentioned several times about CNA documentation throughout the healthcare industry is, the CNA, they just don't take the time to document or whatever. I will tell you, if you're a facility leader, it is your responsibility to make sure that they have the tools to document with. I went in multiple facilities, and when I was doing surrounds, I would go down the halls, and there'd be all of these there'd be all of these screens on the wall, but none of them worked. And then I would say to the staff, hey, well, where do y'all document? Well, we have to take turns at the nurse's station. There's only 2 desktops here, so we have to take turns. So please, to me, most people are very conscientious of their work. They want to do a good job. They don't go to work every day thinking, oh, I think I'm going to do a bad job today. I want to do a good job. So give them what they need to do their job and make it easier for them, for sure.
I was going to say I have a great example of that, Tina. Just when you said that, one of the facilities I was a DON at, they had just gone to computer charting. It feels like decades ago, but it wasn't. The CNA is like, I had an increase in falls during shift change. I'm like, what is going on? And all of my day shift CNAs will be crowded around a table in the middle of the dining room charting. And I'm like, why are y'all here and not on your halls? And they're like, well, this is the only place we have to sit down. And I'm like, well, duh, they've been up on their feet forever. I'm like, I need to provide them a station down the hall where they can sit and they can watch their call bell lights during transition, right? And we did that, and we had a decrease in falls. Everybody's like, well, they should stand and chart. I'm like, why? It's okay for them to sit down, let them rest their feet and have a little bit of rest and relaxation as they're going through. I mean, because typically they're not going to be able to sit for long anyways, because there's a call bell going off here and one here, and they're up responding to them, right? They're not ignoring them. Things like that you don't really pay a little bit of attention to, but those little things do help in the end.
Mm-hmm.
I'm glad you brought that up, Tina.
The next topic was LPNs and RNs. And it says that each state board of nursing determines the LPN scope of practice, and then RNs supervise. Nursing homes in the U.S. employ 4.4% of the country's RNs and 27.5% of the country's LPNs.
That's a significant difference.
Yes.
It is. On average, RNs make up 12% of the licensed nurses in nursing homes. 64% of RNs in the US have a BSN or MSN, which I thought was important because they talk about how the more education you have, the better quality of care, quality of life. Nurses are interchangeable in nursing homes, and LPNs often work outside their scope because they have to. They actively engage in assessments, developing, evaluating care plans, because there's an unavailability of RNs is the most common reason. I mean, that's it. You got to utilize who you have. RNs fill other roles in nursing homes aside from direct clinical care, like QI, IP, staff development, management. I mean, any supervisor role. Regs require RNs that conduct and coordinates the required assessments using the RAI with participation of other health professionals. So without having the right amount of RNs, it does make it challenging, especially not being able to do those assessments. You have to rely on your DON, or if you have a regional consultant that can come in and help that's an RN, you got to find some interesting ways to do that.
Now, you had something that you were talking about with that, weren't you, with the RAI?
Yeah. Well, I think a lot of facilities, unfortunately, all facilities are struggling with that, having that RN coverage and having a good supply of RNs in their facilities. And so a lot of times that falls back on the DON, because the DON is usually the DON is the one that is the most, has the most experience, as far as has a vast experience in other areas. So most of the time things fall back on that RN, DON, when facilities unfortunately don't have that coverage.
You guys are talking about the DON. The DON is a pivotal in influencing organizational and clinical outcomes. A survey of DONs in Florida nursing homes found that 2/3 or more held additional roles, such as the IP, and it's at 68%, quality management, 79.2%, staff education, 64%, and risk management was 57.3%, all held dual roles like that. Yeah. Like, how are you supposed to do your job effectively when you have so much piled on top of you?
Well, I worked 12 plus hours per day.
7 days a week. 7 days a week.
7 days a week.
And then they wonder why we have burnout or DON.
Hi. Sorry about that. There is no work-life balance, it feels like.
It is not. It's so unfair.
But there can be. You build your team around you, and that's one of the mistakes I made as a young DON is I was like, oh, if I don't do it, it's not going to be right, guys.
Right.
I know someone else is reflecting exactly what I just said, and they're like, well, it's true. No, it's not. You need to learn how to delegate. And it's okay if people don't get it to begin with. You keep on educating them and you re-educate them till they get it the way that you want it. But you don't take it back. You empower them to assist you. That was one of the biggest mistakes I made as a baby Dawn, for sure. For sure.
Well, it's very difficult. It's very difficult to let go of something that you're working really hard toward. But you have to realize, as the leader, as the director, one of your main responsibilities is to mentor and help grow your nurses so that, they can, in fact, one day step in and take your place. Right?
Absolutely. Yes, that 100%. Yes. Always hire your replacement and train them.
It said each nursing home is required to have a full-time DON, that's an RN, and DONs have an average tenure of 6.8 years, 16.2 years of experience in LTC, although 42% of DONs have been in their current position for less than 1 year, and the annual turnover rate is 36% for DONs. That's astronomical.
I would have to say, I think it's more than that. I did too. I was going to say, I think it's higher than that. I do.
Well, it seems to have increased for sure over the last couple of years.
It's really scary that they've been in their position for less than a year. and then decreased experience in long-term care, we're just contributing to the turnover rate because you're not setting these new nurses up. Long-term care is a beast. Yes, setting them up for failure. It's a beast in its own right. There's so many different rule changes and regulations that differ from different scopes of healthcare practice. It's on undertaking, and the way you learn something in another part of healthcare is not the same in long-term care. You can be successful. We just need to set our DONs up for successful DON training like we do at Qsource, right? We're taking on a brand new DON. We set them up with their skill sets that they need for their daily task, their weekly tasks, their monthly tasks they need to work on, and how that all correlates around QAPI and their risk management pieces. When you set someone up for success, they will succeed.
Yep.
I think that's what we do here at Qsource with our DON training, for sure.
Absolutely. Especially since in many nursing homes, the DON may be one of the few RNs or the only RN. That happens a lot.
Yes, it does.
To administrative responsibilities, they often have to address clinical needs of residents.
That's true.
Two-thirds of the DONs on this survey reported that they often needed to provide direct resident care, or they were pulled to the floor. You've heard that term before.
I'm not shocked. I'm not shocked.
Reported it occurring daily and weekly.
Yeah.
How are you going to job done?
I don't know if some of the facilities really have read the regulations, but a DON, and there's a number of beds, and I want to say it's 100, or it might be a little bit less. I can't. Lindsay, you're the expert. The number of beds, if the DON cannot be pulled to the cart, because you cannot expect a person to manage a department when they are being pulled to work a cart.
Right, because you're focusing your time on a subsection of residents instead of you're supposed to be focusing on the residents as a whole. You're responsible for everybody. And I think you are right, Tina. I think it's based on occupancy, like the percentage of occupancy.
There's a definite number, the regulations.
Yes,
and
there is.
And then that regulation, some facilities don't realize that. They can be cited for that. They sure can.
I've seen people get cited for it, Tina. We've helped facilities out of some crises since I've been with Qsource. Just a little over 2 years, we've assisted with clinical consulting related to that, and they've been fined hefty fines and citations related to not having the RN coverage and it usually falls underneath that, right? Because the DON is the only RN in this facility during those times, or it's the weekend and that there is no RN whatsoever, and the LPN was doing the RN duties. True story, we helped mitigate an immediate jeopardy for a facility that had that occur, and it was related to tube feeding. With the LPN practicing out of their scope of work. Thank goodness they just had the IJ for that day. We were able to assist them with that, but these are real regulations that you have to follow. And with numbers like this, it feels like, it's hard to combat that, but I guess the best thing to reduce these numbers is you have a brand new director of nursing. It's okay to have a new director of nursing, but don't set them up for failure. Set them up for success. Understand that they cannot learn their entire job in a month, 2 months, or 3 months. It takes a while. Continuing education, right? They will learn from their mistakes and they won't make them again. We're not saying that you need to make massive amounts of mistakes, to be successful, but set them up so they mitigate those.
With 50 years of experience and experts across all areas of nursing home care, Qsource genuinely understands the needs of your facility. We've always been there alongside you, and we've walked in your shoes. No matter the situation, Qsource is prepared to tackle your challenges, solve your issues, and answer your questions. Let Qsource encourage, educate, and empower you. Contact us at any time at qsource.org. We will always be here to help. And now back to the podcast.
That leads us into our tips for DONs. They're going to need
Okay.
to identify their support network, figure out where to turn for help, build your network, join professional organizations, participate in online forums, conferences, and workshops, and realize that it does take time. It's going to take time to build your knowledge and your network. You want to learn how to delegate and walk away. The only way you're going to get things done. It's an excellent way to recognize strengths, like you said, Tina, build leadership skills in your staff, and completing daily tasks won't leave you feeling non-energized for higher level planning and oversight that your position demands. You want to be up to speed on regulatory requirements, learn federal and state regs, compliance, and prep for survey, staff to resident ratios, care plans, protocols around resident data, food and nutrition. You want to explore different staffing options. Budget is always going to be the top of the mind because you don't always have the finances to hire travel nurses or allied pros. And if not available, DONs have to fill these positions or they operate shorthanded. And we all know how that is. It's no good for anyone. Because when you have plenty of staff, people feel energized and it positively impacts your residents and the care they receive. And ask for help when needed. Often others are going to have answers. Be respectful of the positions and their knowledge. A CNA might know something that you need to know. A nurse might know. It doesn't matter who they are. They have knowledge. Look for opportunities to improve communication and management skills. Ways to cross-train, connect with staff on the units to gain better understandings of staff operations, procedures, and what different roles entail. That's how to be a good DON. I mean, is there anything in that list that you guys feel like could be added?
Listen to your staff. Listen. And it's okay for you to say no. You are not there to please everybody. You're there to do a job. It is not a celebrity contest of who likes me the most. Right. You are doing your job to the best of your ability, and it's okay to say no.
Things right. People aren't going to like you, but you're doing what's right.
Right. And and as a leader, you have to make your staff feel valued.
Absolutely, Tina.
You've got to invest in them individually, get to know them, and see what motivates them. Everybody is motivated by something different. Yeah. So getting to know that about your people, that is very important.
And it takes time to do that, but it's well worth it in the end. Yes. It takes time. You're not going to know that over one night. It takes time. And it's okay to have time. It's okay to have time.
Next topic is administrators. They have oversight and operational responsibilities, including ensuring regulatory compliance, supporting resident rights, and maintaining financial accountability. Their domains of practice provide framework for national examination of nursing home administrators, including customer care, support services, HR, finance, environment, management, and leadership. They touch every part of the facility, and they should. Good administrators are good teammates with their DON. They're like this.
They're like a marriage. It's like a marriage.
It is like a marriage. It feels that way sometimes.
Federal regs for nursing homes require an administrator to be licensed by the state. And we do have some tips and traits of a successful SNF administrator too. They see beyond regulatory compliance. They go beyond that minimum standard. They aim for the gold standard. You don't want to merely check off a requirement checkoff list. You want to look for opportunities to better meet resident satisfaction and improve efficiency. We want to stay up to date on the industry because a strong admin stays ahead of the pack and serves as a change agent. They focus on innovation with best practice to remain successful. They just do. They provide mentorship to AITs or administrators in training. I've seen that in action, and it's so fun when a good administrator gets to train a new one. It's wonderful. You want to build a strong supporting cast, and they talk about it like it's a play. You want to share your knowledge of industry, lead by example to guide your team. You have to assist leaders through times of change and uncertainty, even when you're uncertain. We want to prioritize person-centered culture, staff engagement, embrace, support, and promote a culture driving quality of care and outcomes that's woven into your daily operations. Don't just say what your vision is and then don't live it. Do it daily, every single day. They're going to implement systems and technology that can streamline workflow, integrated tech to improve systems and data, which includes audits, to systems to ensure the integrity of billing, financial data, EMR platforms, clinical systems, and you're going to validate those system processes. Are they operating appropriately? You want to recruit strong candidates because you want to promote program to staff to demonstrate advancement opportunities, relationships with colleges, with admin programs, local recruiters, trade associations, professional societies for leads, and promote your benefits. Every benefit that you have, recruitment, retention, AIT training, if you can bring a CNA class in to host them, do. All of that's going to help you. All of it. Yep.
One of the, some of the strongest administrators I've worked underneath were not, I'm sure, Tina, you've heard this too in the industry, they were not the 12 to 3 administrators. They come in at 12 p.m. and left by 3 p.m. You're laughing because you know those administrators too.
You've
heard of them.
That they are out there. But I will tell you this. Some of the administrators I've had the privilege of working with over the years have been the best mentors for the director of nursing. Because to me, again, going back to leadership, that's a responsibility. They have to be a good mentor to grow their team. My hat's off.
Change oversight. That was like one of my favorite administrators, was all about the change and working towards that change, and in the face of adversity did not run and hide, but was right there with his staff out on the floor helping do whatever.
Think about what when COVID first hit. Just think of how everyone, especially the leadership, especially the administrators, the DONs, and all of the other department heads, think of what kind of test that was for them to showcase their abilities and to be able to learn from their mistakes, because that's what we do, right? We learn from them.
Yes.
And how now, if you look at the same ones today that were there 3 years ago, look at how strong they are as leaders.
Absolutely. Absolutely. I was going to say one of my favorite administrators was definitely a mentor to me during the pandemic, and he allowed me to make mistakes, but also helped me build up from those mistakes. And, I'm ever thankful for that.
You talked about how Qsource can help, but we're going to sum it up right here. So training for staff leadership and development, not just the DON, but the nurses, the CNAs, the MDS, the administrator, all of that. So for the DON, leadership training to ensure they understand their basic responsibilities, those clinical meetings, review, PPD, risk, QAPI, regulatory compliance, check. I mean, the list goes on. They have a lot of responsibilities. MDS training to ensure they know their responsibilities and expectations, the RAI, how to complete correct coding for appropriate payment. I mean, that list goes on too. Nurses, leadership training, building up a team to succeed, instilling values, tips to succeed, expectations. CNAs, training for resident care, teamwork, values to succeed and advance in their career on through the chains. And I found a quote by Maya Angelou, and it said, "As you grow older, you will discover you have two hands, one for helping yourself and another for serving others." And I thought that was just a perfect close to this podcast, because every single person that we talked about, every single title we've talked about is an integral part of your facility. And it's not just one person doing great that makes your facility great. It's the culmination of
everybody.
Absolutely. And everybody. You cannot pour from an empty cup. A hard lesson to learn.
Yeah. Absolutely. Absolutely. Okay, ladies, you got anything else you want to say here? Otherwise, I'm going to the teaser. All right. So next week, we're going to talk about why choose to work in a nursing home. What is it about nursing homes that are so amazingly amazing? We're going to find out.
I was like, everything.
Yeah.
Everything.
That's a great topic. Can't wait to talk about that.
All right. Well, thanks for joining the Q's Weekly Podcast for all your nursing home needs and topics. And until next time, have a great week. Say bye.
Have a great week. Bye, everybody.
Thanks for listening to the Q.
Thank you for listening to this Qsource podcast. If you ever find yourself needing Qsource to assist your facility, please reach out to us at qsource.org so our long-term care experts can help you through the process. If you want to hear more podcasts like this, you can find us on Apple Podcasts, Google Podcasts, Spotify, and wherever you listen to your favorite audio. Just search for Qsource and you will find us. Thank you and have an amazing day.